Today, we are going to have our fireside chat, and then we'll move into allowing you all to really contribute to the question of what's working well in your organization and what are some challenges that you are facing. And we're excited that you have an expert here to answer some of those questions that you may have and also to share guidance on what's worked for her well. We have the distinct honor today of hosting Melodie Narain-Blackwell, who's the founder of an organization called COGI, the Color of Gastrointestinal Illnesses. And Melodie's work is deeply personal, which I'm sure she will share. And her mission is to ensure that Black and other marginalized communities are seen, heard, and prioritized within the healthcare system and within patient advocacy work. She has herself been a powerful advocate to bringing awareness to gastrointestinal and other diseases that disproportionately impact communities of color, but are often overlooked in research and diagnoses and in treatment. And through her organization, COGI, she has created a space for education, advocacy, and change. And her approach is really rooted in trust building within Black communities, making sure people feel empowered to advocate for themselves and their own well-being. And today we'll have a conversation with her that should hopefully reflect the urgency of addressing health disparities and give you some really, I think, stark insights on what you can do to be more solution-oriented in your own engagement with Black people. So we're going to dive into a fireside chat. We want to make sure during this chat that if you have questions or insights or aha moments that you share them in the chat box, and then we'll open the line up for questions for Melodie, as well as an opportunity for you all to share what's working well in your organizations and maybe some of the challenges that you are facing. So first of all, welcome, Melodie.
Thank you so much, Chrissy, and thank you, ABC, for having me and allowing me the opportunity to share in alignment with your health advocacy work.
Absolutely. We're so excited to have you share today to tell us a little bit about your story and the impetus behind you starting your organization and some of the ways that you're really engaging the Black community and other communities of color successfully. So I'm going to dive right in and ask you what inspired you to found what used to be COGI, Color of Crohn's and Chronic Illnesses, and now has evolved into COGI, Color of Gastrointestinal Illnesses. What inspired you to found that organization, and how did your own personal experience guide that journey?
Oh, I love that question because that's the root of this entire foundation, right? So in 2018, I actually got diagnosed with Crohn's disease, and it was the eureka because I had been managing symptoms for a really long time, for over 25 years. So when I got diagnosed in 2018, I was actually 36 years old. But the challenges that I had with digestive health presented around the time of 5 or 6 years old. And I would use the bathroom for long periods of time. I would just be sitting in there. And I laughed because I probably knew every Jet Beauty of the Week that came out in Jet magazine every week, because I would sit in the bathroom and look at the Jet magazines or the Good Housekeeping or whatever was in there, or I would bring Barbie and Etch-a-Sketch, right? So those are the things that I did to manage my long-time usage of the bathroom. And as I got older and the symptoms kind of would come and go, which we know are part of managing life with the IBD and inflammatory bowel disease, they would come back sometimes a little more aggressively. So I'd have more stomach pains and I would use the bathroom and I would think that it was just food indicative until I was 13 years old. And that's when I started having rectal bleeding. And when I went to the doctor at 13, my mother took me to a gastro and I shared with her finally after a few weeks that I think I'm having rectal bleeding, because at first I thought maybe I wiped too hard. I thought that maybe it was something I ate, and it wasn't anything that I was doing, and I was still having this bleeding. And I went to the doctor, and the first question that the physician asked my mother, the gastro, was, "Is your daughter sexually active?" And I'm like, is that the question that you ask about a 13-year-old child that's coming to your office, whose parent has said that she has had stomach issues from this age, that they've been persistent, they've kind of been on and off, but she's had them. She's had times where she's used the bathroom for hours or laid in the bathtub because her stomach was aching and she felt like she was on fire. And your first question is your daughter sexually active? And I said, wow, that's pretty interesting in this whole navigation of what's taking place. Eventually, this doctor did a flex sig, which is a invasive procedure. He did it while I was awake, and my mom almost passed out inside of the room while this was happening. And I have a very vivid memory of that because he said, "Are you okay?" And I said, "I'm fine. I'm managing through the pain." And he said, "Not you, mom. Get mom." And so that stays in my head because I will never forget that my mom had that kind of reaction watching me endure this kind of procedure. We did not go back to that doctor because what he said was, "Your daughter just has internal hemorrhoids." So he discredited all the other symptoms and the anal fissures and the fact that I did have bleeding that was internal. And so he just wrote them off for a 13-year-old child that it was just this. And all I needed to do was drink more fiber, Metamucil, Citracel, or infuse more fiber in my diet, indicating that he thought that we didn't eat well, which we actually did. So stigma, bias, and one of the barriers that we face being in the communities of color, because my father is an Indian man and my mother is a Black woman. So as I marched forward through years of talking to myself in the mirror, saying I don't have these stomach aches, these are not real, I'm making this up, and dealing with years and years and years of rectal bleeding that eventually caused me to have 8 fistula, loss of mobility, loss of hair, and subject me to over 14 medications and wearing diapers for 4.5 years, I have now forged a pathway for other people not to endure the pathway that I did to actually get to diagnosis.
Amazing, amazing story. Thank you for sharing that with us. And I know that you had your own unique challenges getting to diagnosis and treatment while navigating the healthcare system as a Black patient. Tell us what are the other unique challenges that Black patients face in this journey?
You know, it's so many. I just talked about just bias and not presenting classic textbook case symptoms of what is indicative of IBD, inflammatory bowel disease, or a digestive disease, but not being qualified due to bias of what it looks like. IBD is a disease of any and everybody. So race should not have been a disqualification for me to be afforded a proper diagnostic journey. So that's number one, right? The second thing is that these communities, our communities, because of bias and the onset of race-based challenges at the entry of the healthcare system, we haven't been afforded even education on digestive diseases. And that's not even due to just socioeconomic challenges. That's due to what's been taught historically in medical school. So doctors are being miseducated and educated to be biased against us. And so how does that help to expand our ability to be able to be qualified in a system that's supposed to do no harm? It's actually doing more harm. And so we go to these systems to get help, and then we actually become one of the numbers in that 41% chance of death or serious morbidity in digestive disease. Other challenges are health literacy. We don't have the language often to advocate for ourselves. So when we go into these centers and the doctors say, it's just this, we become a heavier burden on this emergency room system and the healthcare system because we are dealing with pain. We are dealing with the challenges of digestive disease. We are now having mental health issues because we're being told that it's not a disease. You don't have anything. There's nothing wrong with you. It's a you problem. And then it now begins to be psychosocial. And we're dealing with all the other things that are external, including managing family, managing work, and then managing a whole person that's now self-destructing because they're dealing with an autoimmune disease that is not meant for them to manage. They need the proper care. So the list goes on and on and on, even down to not understanding how to engage with policies that are doing more harm than help.
And so you've given us enough reasons why whole communities would have mistrust with systems, with the healthcare system, with advocacy organizations. We know the history of systemic racism and how that's applied, but even in our modern day interactions, there are enough reasons for us to have mistrust. How do you feel that mistrust then affects the way that Black communities, number one, approach their health, and number two, engage with healthcare providers?
Oh, we are so resistant. You know, me doing the work that I do, I think people think that just because I'm a person of color, I'm Black and brown, that I automatically even get the trust of my community. I don't. I have to learn it and earn it. Because like you said at the beginning, every Black person isn't the same. Every Black community isn't the same. There are certain things that we can relate to as a culture and as a community because we've had to learn to survive and figure out how in that survivorship, how we thrive. And so the relationship does add value, but even there's so much that we have to do to build trust. And that includes not coming in with a sweet deal and then leaving people with a cavity. And that's what's historically been done, even when it comes to science and research, which why there's a huge lens and layer of mistrust for this system, because they offer something and then pull it back when they're done with us.
Wow. How did all of this inform you starting COGI and starting your organization? Like, how did you get from this difficult journey to your own diagnosis and turning that into an organization that's helping other people?
Oh, it's so interesting. I think that oftentimes we're more empowered to do things for others than we are for ourselves. Like we'll sit and feel like, oh, there's nothing I can do. But if we see someone wounded, we're often running to go and rescue them because of our heart posture. And for me, as I was managing just the detriment and the deterioration of the disease, I kept feeling like it was for a purpose and a reason. And I had all this experience of entrepreneurship behind me. And I said, I don't know what I'm supposed to do with this. I'm going to say that word, right? Shit. Because that's really what it was. A whole bunch of it every day, 30 times a day, some weeks. And I said, what am I supposed to do with this? And I didn't feel like a victim. I just didn't know what was supposed to happen, but I knew that there was purpose, because there's no reason that I'm supposed to be losing my mobility, deathly afraid of needles, and now I'm injecting my stomach, doing my own IVs, doing all kinds of things like that to manage life. And there's not purpose behind it, because God does all things well. And so there was a time where I could not really move for 3 months, and I was kind of bedridden. And I kept hearing, if you build it, they will come. If you build it, they will come. And I said, well, what am I building? Because I can't get anywhere. But what I know is that you can lose your body, but you can't lose your mind. So you have to hold fast to that. So as I was holding fast and I was staying in prayer and waking up every day practicing gratitude, I found something to be grateful, 5 things to be grateful for every single day as my body continued to deteriorate. And I heard the whispers of building, building, building. And I learned. I sat there and learned, and I said, why do people think they're the only Black person with this disease? Why are they saying only 3% or less of Black people have this disease? Why am I not finding Black or brown people talking about this? Why am I not seeing representation? Why am I not seeing any support? Why am I not seeing education completely targeted to this community? And that hit me. If you build it, they will come. And so I started with a Facebook group, and I started messaging people at 2, 3, 4 in the morning because I could not sleep due to pain and challenges with the disease. And I said, hi, this is my name. Here's what I've gone through. I was finally diagnosed. I don't know if you need a friend, but if you do, I'm here to talk to you. There's nothing wrong with what you're experiencing. And in fact, it's probably all right. And you're not alone in this journey. And hundreds of people later, we're an organization, now thousands.
Wow. I mean, it's just amazing. But why did we need a COGI? Like, you talked about the fact that Black and brown patients weren't readily talking about this. You didn't see them in representation. There are major national organizations, some represented on the line today, that deal with all the diseases that disproportionately affect Black people, right? Whether it's diabetes or heart disease or cancer or Crohn's and colitis or whatever the case is. Why do we need a COGI?
Representation and cultural allyship, cultural synergism, all of those things are important to our community. And when you have something like these disease spaces that are blanketed, usually the blanket doesn't cover Black people. We just kind of find our space just like under it, so we don't know what the disease looks like for different skin hues and on them. We don't know how it impacts them because there hasn't been research or anything completely targeted to this community. So no one really knows what the manifestations of disease look like. And I'm not just speaking in digestive disease, I mean chronic illness and as a whole. That could be dermatitis, dermatological diseases, it could be diabetes. But when it's not hyper-focused on communities that have been disregarded, they will continue to be disregarded because no one's going back to intentionally figure out, why are they disparaged? Why are they in this space where it's like they're disproportionately impacted, they're disproportionately infected, there's an uptick of death, there's an uptick of ignorance and disregard. It starts there. So if we don't have an organization that's intentionally focused on moving diseases forward in specific communities, especially in the Black community, because what we know is the harm has been built on the backs of Black and Brown communities. That's where the medical system started, in the inequity of Black and Brown people. So of all the minoritized communities, the collective majority comes from first supporting Black community, because that's the only community that when it is supported, it trickles down to every other community getting supported.
Yes,
so it's right to support Black community, because we make it a collective majority. There's no other community that you support that will make the minoritized communities a collective advancement of support and make us a collective majority.
So I love that. But before we talk about specifically how you created COGI to be culturally relevant and engaging to Black communities, I want to ask a question that just your opinion, because I'm sure we have differing thoughts on the line today. Can organizations led by and built for the majority address Black patients and Black needs? Do they have the ability to?
I absolutely believe that. I absolutely believe they can, only if they are connected to authentic change agents. They can't do it by misappropriation.
Okay, tell us more about that.
I think a lot of times, historically, there's already a messaging that certain organizations or companies have delivered about certain communities. And because that messaging is there, you have, I think, two different kinds of communities. The ones that really want to be connected and like they see, like, I want, pick me, I want to be a part of this. And then you have the others that say, well, you didn't care about me before. Why now? And so if there isn't genuine, authentic approaches, connectivity, and reaches, then you won't have built anything that's trustworthy to create trust. You'll only get those that are like picking me, and it won't ever advance the community. It'll still stay where it is, and it won't move forward.
So true. So let's talk a little bit about what you've done with COGI, because you mentioned just you being Black and Brown, a person of color, didn't automatically give you entree into trust and entree into recruitment of Black people that would come and feel welcome and included and all those things. So tell us how you designed your organization to be culturally relevant and how that has shown up in success for you in kind of building a following in the Black community.
So what we recognize, honestly, is like, first is that mental health is huge in our community. There's a lot of race-based trauma. And we start to tolerate it and manage life with it, not recognizing that it's a huge part of the burden that we carry just being Black. We're carrying the trauma in our bodies, in our minds, in our deliveries, in our communication. And I felt like, as a person who's not only leading but also a patient, that if I didn't tackle some kind of support for mental health for our community first, there was no seed that could be even planted to create educational opportunities, because that meant the ground wasn't fertile. So the first thing I did, even as an organization, was build a space for support group. And I didn't call it a support group because Black people generally don't like support group. We don't even like hearing that term, like, I don't need support, I'm good. It's like, it's off-put because mental health is associated with crazy. It's associated with negative feelings, emotions, and trauma. And, oh, that person is crazy if they're going there. I don't need this. I don't need that. That's for that. So we had to, I personally had to say, how do I destigmatize this, because it's extremely valuable, and offer a place where people can actually sit, be themselves, and release some of the trauma that they're experiencing while they're living through life as a patient, because we don't sign up to be patients either, none of us. It's like a title that gets placed on you, and then you're supposed to be able to navigate an extremely complex system that even the people working in the system don't know how to navigate. Have you called these people? They don't even know where to direct you. So we're supposed to be able to figure this out, and they can, and they're inside. So I started to build our trust and our programming through support groups first. And that was my first engagement of how to ensure that I was creating something that would be sustainable and resonate as healthy, viable, and trustworthy with our community. And
But you said you
they
didn't
know
call
that they
them
can talk to
support
you.
groups, right? You said you didn't call them
No,
support
no, no,
groups.
no. It was not called support group at all. So what it was called, the very first support group was called Together IBD, because who likes to do anything alone? We say, I'll do it alone. We say, I'm fine. We say, I'm cool. But all those words really, if we really take a deep dive into people that we love, they cover things up. I don't feel like talking about it. I don't want to explain it to you. You're not going to understand anyway. I just want to get over it. I want to move on with my life. So what I said was, hey, Together IBD, because we do this together. Let's do it together. And so the group started with like 3, 4 people, and then it grew to like 40. And then we had to start segmenting it out because there was so many people actually coming to talk about their life while managing this digestive disease or these digestive diseases, because it expanded. And from there, we got to listen to so many of the things. And when I say we, it was me and one other person. I was doing this work for a long time, kind of alone. And then I got some volunteers. And so it was just me riding this bike. And then I got into a 2-seater bike, and I got a couple people. I got a car, and, we got a minivan, so it moved. But I would listen and I would take notes and just make, like, from what I knew as a person that came from music and fashion industry, and coupling it with what I know about culture, people, and human beings, and how to be a person that moves through sales opportunities, because sales opportunities are really opportunities to connect and engage people with what's meaningful for them. So I used those things and hearing what their needs were and where they were missing to create other programming. So from Together IBD, we moved to education. What is this disease really? What is it? And so we started educating them in ways that spoke to them, not above them and not beneath them, but right where they were. And a lot of times our communities are given a lot of misinformation just to get them out of the office. So they're really living life misinformed, and they don't even know how to inform the people that love them. And so they're being judged and stigmatized in their own homes, and the depression is sitting on them there. And so as we delivered by listening, hearing, and then going to action, we were able to create our first equity symposium, and that presented with culture. And we had dancing, we had food, we had music that was completely curated and cultivated to look like us. And instead of using words like diet, we use nutrition equity or food moving people forward. We don't use words. Our words are very intentional. I don't use words as a health equity architect that triggers any kind of systemic trauma. I don't say food is medicine because the medical system has been harmful. Why would I say something that could trigger challenge? I don't say clinical trials because trials actually, in many people's minds, goes to the injustice of the justice system. Why would I say trial? Because if someone removes clinical, it doesn't stand good alone. And so we don't think forward in this system, but in building ecosystem for the people, not for me as a scientist or as an architect, but for them. I'm creating systems that create their advancement. I have to want to advance them. I have to want to walk with them, and I have to put myself in their place so I can be their person.
That's amazing. So you're talking about how words matter. And I don't think we consider that enough, right? Like what we name things, the nomenclature, how we refer to things, people, the visceral and or emotional response people have to different words. Tell us more about how, were those things just innate to you, or how other people can tap into doing better with vernacular and what they name things and how they refer to things?
I think tailored health literacy is innate for me. It's like one of my jams. I love it, but I'm always thinking about us because I think about how I present to my children. I think about how I present to my community. I go back to how I would present if I was still in the music or fashion industry. And I think about who my people are. And so I don't think about my people as being the doctors and the providers because they're already speaking at a level that's too high, and far reaching. And a lot of times I know that my community has shared with me that they go to the doctor's office and they're just sitting there and they're listening and then they leave. I remember being on a call and someone says, how often are you asked about biomarkers? And my thought was, why would the doctor be asking me about biomarkers? They should just be saying tests. What are your tests? Have you had your test? We change things so much when we can just keep it so very basic once people grasp it, to keep it in a place where they can receive it, respect it, and then move forward. But we don't. We start moving the goalposts to disregard them and disqualify them. Why? Why? If we're saying we want to be inclusive and intentional, why are we intentionally disqualifying? And so tailored health literacy is something that I take a lot of pride in, but it's something that I feel like I have created my own space and my own lane for that, because people come to me and they pay me to do that with them and for them, because I feel like I'm just this hip hop language health equity advocate, and it just goes with how we do things over here.
Tailored health equity. We're going to remember that, because we might have curated a whole like sector of work and training and facilitation, but tailored health equity. So I'm going to ask you this. Tell us a little bit about Black men, because I know you've created a format for them as well, how you named it, how you've engaged Black men. We know, and not to make generalizations, but Black men tend to equate healthcare with emasculation, with good historical reason. They tend not to complain. They tend to not want to be as vulnerable. How has your organization engaged Black men, and what does that look like?
So I will say I love men. I love Black men. I think that our men are great because they can reach things at the grocery store that I can't. And so, you know, for many other things, but that is, I'm a short person. So that is like an extreme value for me. But I will say that when it comes to pain and crying, there's so much stigma. And a lot of times when it comes to the severe impacts that these digestive diseases, IBD, have on you physically, our men will have suppressed it because they're not allowed to express that they are having pain. And so more times than not, they're going to be treated, they're going to these hospitals, and I have found that they've been treated more for mental health issues more than their physical issues, because the pain is now having so much turmoil on them that it's working against their mental and their emotional, and the fatigue and all of those things start to oppress them when it's really been in their gut the whole time. And so what we did when I looked around and I thought about like just suppressing emotional pain, ignoring physical pain, their mistrust with the healthcare system, not feeling confident in the language, not always knowing how to really describe what is happening, I said, how do we redefine sharing this as still being masculine? How do we support mental health advocacy and a space where they can be authentically vulnerable and not feel like it's at the helm of like women having to pity them or say, let me give you hugs and feel bad and, you know, give that kind of emotional support. So we created a group that would educate them and support them specifically in their spaces where we have a provider who is a male. We have advocates who are males that support like physical movement and like them ensuring they're on the right treatment plans, and mental health educators and practitioners, and it's called the Huddle. And men get to be in a space with men. And so it's not even just patients, but we have family members like sons and fathers and husbands that actually come to the Huddle too, because they want that support, but they also want to be educated. And I think even getting the connection of community from that space, they can even hear what men are managing in this. And they're able to even connect the dots in a space that feels more full, because it's not just my wife going through this. Well, my wife shared this. Have you tried this? And so now they're passing remedies and they're sharing, and they have their own personal space at our conference. And, you know, they have real authentic community-based education and engagement where they can express themselves loudly and proudly and honestly, and not feel like there's this lens of females having to pity and support them in a way where they're now uncomfortable and they feel like embarrassed. Like, we want to remove that because this is tough to manage.
Yeah. So we're going to give you a chance to give some advice. What advice do you have for healthcare providers, healthcare institutions, and or organizations dealing with patients on forming meaningful partnerships with Black communities?
I always encourage organizations to connect. I cannot tell you, I started a group with some organizations a while ago, And we started supporting authentic engagement for them. And it was me and two other individuals that have organizations. And it was kind of like we saw them showing up to all of our events, just showing up. They would sign up, they would attend, and they would say, "This has been great. I've learned this, I've learned this." And I said, these leaders don't just want to come and learn. They really want to do the work to advance communities of color authentically, and they don't know how. And what's better than to be a ally, a brother, a sister, a friend, because that's what we do in the Black community. We make family, we're a family affair. And so I messaged them and I said, "I want you to be a part of this family. I want to support you. I've watched you now for 2.5 years. I've seen you send people. I've seen you find people in your community and ask me to connect with them and engage with them. And it wasn't from a space of how can I just pull from you? How can I repurpose your materials and use them and have this inauthentic, disingenuous relationship with you? But you've been genuine, and I want to genuinely serve your community as well." And that kind of authenticity doesn't have to be in the same disease space, doesn't have to be in the same specific industry, but authentic engagement and true relationship advances all of us. And that right there will move the needle forward for people. We're in this world to serve people. I always say I'm hyper-focused on Black and brown, but I'm wholly focused on people. And that will never shift.
Yes. And so you mentioned not just repurposing the materials and those kind of things, because we know there are ways that well-intentioned organizations kind of misstep, right? And while it takes forever to build trust can be lost instantly, especially if, patients and communities feel like you're either wanting them for data, you're not, authentically standing up for them and advocating for their rights. And also if you are not truly empowering them to lead their own pathways. So you mentioned materials. One of my pet peeves is seeing organizations who aren't doing the work, but have all of the Black people on the brochure, right? Like all of the people of color on the brochure. Like you have the Rainbow Coalition of everyone you want to purport to represent on the brochure, but when we dig deeper, you're not doing the work, right? Or, every time there's an opportunity for you to have a spokesperson, that person is a person of color. But when we really dig into how much of a percentage of your work is focused on communities of color, it doesn't rise to the occasion. So how much harm are those efforts doing to those of us who are on the call, maybe today, who are really invested in doing better and connecting with communities? Do those missteps really impact the whole ecosystem of what it means? Uh-oh, you're on mute, Mel.
Oh, I didn't realize. Okay, sorry. Can you hear me?
Yes.
Okay. So it does so much harm, and I will tell you why. When I just said I said earlier, you tell people something sweet, and then they come, and then you leave them with a cavity, right? That is what I refer to things like that as, because they'll now go to your organization looking for something, and you don't have the infrastructure to support them. And so they're looking, they're pulling, they're calling, they're messaging, and they're trying to find it. And you haven't established any real relationship with an organization, a company, a partner that can do the work that you're purporting to do. And now you've left a bad taste in this person's mouth, and they're going to run tell that. They're going to talk about it. They're going to now say, "This is how I felt. This is where this left me with." They don't support these communities. So you miss the moment to actually move the message, and the measurement of your validity decreases.
Mm-hmm. Would you go so far as to say that some of these institutions and organizations need a partnership with an organization like yours or even like mine to succeed?
Absolutely.
Can they do it without you?
Absolutely, because it's a validator.
Oh, it is.
I keep pushing the screen, and I thought my phone, this is a very new, I've never, two devices. But I say yes, you need an authenticator. You need it, but not even an authenticator to check the box, but a real authentic relationship. You need that. So do the work. You have to do the work to build, because I'm not always so quick to say, yes, I'm going to partner with you. I'm going to go through your history, and I'm going to want to understand why. Why do you want to partner today? Why now? What inspired you? You know, what triggered you to want to do this? Why do you want to do this work? And are you ready to do it? And what does that mean to you to do it? And what do you expect from me? There's a lot of questions and answers and relationship building, even as it comes from me, because I've invested. And I don't mean just like invested on just doing the work. I closed my restaurant, you know, and I started this because the Lord told me to. This is a heart posture for me. And so with that, the funds, the things that the Lord has blessed me with to serve his people, I have a responsibility to honor that and to honor them. And so my responsibility, I want to do my due diligence to ensure that whatever I present to them, that it remains trustworthy, because it's going to be on my back. It's now from my drip that you get to be validated. So it needs to be right. I have to ensure that you are who you say you are.
Wow. So what are you doing over at COGI to break down the barriers of unconscious bias?
I'm just kicking in some doors.
What does that look like?
So unconscious bias, you know, it's interesting because a lot of people still, and I'm careful when I say this, I think that people if you don't live it, you don't really believe it. And that's a challenge, because when you're Black, sometimes you take a step back and say, is this really happening to me? Because that was part of my experience. It wasn't until I started talking about it that I realized that it shouldn't have taken me about 25 years to get diagnosed. So I didn't think I was subjected to unconscious bias. And I said, oh, wow, because we still want to be careful about, is this racism or not? Is this bias or not? So we have to honestly acknowledge that unconscious bias is a real challenge in the healthcare system. There's too many stories to disqualify and disregard it. It is real. And so that's one of the things that we talk about, is that it is real. And here are tools that if you even feel just a glimmer of it, start to advocate for yourself so that you don't become a casualty of it. And so that is one of even the ways that we try to mitigate it, is that even if you just feel a glimmer of it, start to advocate for yourself. And that means understanding what it is that you are actually facing, like your disease. I just had something recently happen to me that I felt was biased, and I had to deal with that because I got diagnosed with another condition. And so when I felt it, I said, you don't know who you're dealing with. Let me learn you today, because that's what it required. But I prevented myself from being subjected to another set of harms. And so we have to not even underestimate our own pain and what we're dealing with, because then we'll start to minimize it too. And so we'll say, okay, well, they said that I didn't have this. So like I did when I was going through college and high school, I'm not really in that much pain. I'm making this up. There's nothing wrong with me. It's just stress. So we have to recognize, like, no, I am in pain, or this is uncomfortable. This is happening to me. Let me start to make notes about it. So I personally have my own tracking, and I'm not subjected to the harms of anybody else's bias. I also empower our community to understand the differences in treatment. Like, if you know that you actually may be having some failure or challenges on your current medication, and it may be time for your doctor to consider something else, and they're like, hey, just wait a little while, you're fine, just wait. Oh, no, that's nothing. Start to investigate. That's why community is important, because I see all the time in our COGI group that people are asking questions, because unfortunately, it's not discussed often that when you have IBD, there are other comorbidities, and skin manifestations are part of EIMs, and joint issues and inflammation in other parts of your body because it's an autoimmune disease. Also, understanding that there should be certain types of patient-provider communication. And if your doctor is not engaging in what healthy patient-provider education looks like, fire them. That is like a golden rule. And I think people in our community feel so fortunate because we still honor our providers as God, because they are there to provide something that we can't. They've been to places that we can never see, places unseen, and so we're thinking that they are God, but they're not. They're humans, and they're practicing medicine. And unfortunately, if this does not work, you no longer get to practice with me. And that's okay.
Yes. So listen, you talked about empowerment, which is really, I think, the formula to making sure that Black communities are engaged, because we know the difference between allyship, whether you're a hospital, a provider, a person who's not a person of color, and saviorism. And we also know, and hopefully we know, that the Black community does not respond very well to saviorism. So how can the practitioners who are on the call today and those listening in really work to empower Black patients to, be their own advocates? What does that look like?
Well, I think providers need to go through bias training. You talk about, I say cultural allyship, but I think like that is important, cultural allyship. And that includes that when you're not of the culture, find a friend, physician who is. That can help. Because in our community, seeing someone like you isn't always like the path to go, but it provides a layer of comfort and energy that community brings. And so like that is huge. I also say like do some self-reflection and support your patient community to do that as well. Examine their own selves. Like we talk about how we present information and how we receive information is really important to what's going on. And so if we're not both clear on what's happening here, it could trigger other challenges. And so as you are delivering, and I'm speaking to practitioners, I'm speaking to those that are on the call, as you're delivering, right? I talked about tailored health literacy, tailored health equity. I talked about these things. It's important. Who are you talking to? Who is your message going to? And are they receiving it? That's communication 101. It's not what you said, it's what they heard.
Yes.
And it's how they responded to it, how it made them feel. Did it give them what they needed? I would also encourage them to have objectives for whatever it is that they're trying to do. If you're trying to do something to advance the community, what are your objectives in advancing them? What are you trying to do in this equitable opportunity? Are you trying to increase overall diagnosis, increase overall testing, increase preventative screenings, increase education and understanding? What are your objectives? Because if you don't even know what you're doing, you're just putting out something to say we did it, then it's not meaningful. A lot of times we get people saying, hey, we fund you to do this? And I say, that doesn't mean anything to my community. Putting your link here will do nothing for us. So no, you can't fund me from doing that. And many organizations will say, well, it's money and all you're doing is this. That's not all I'm doing. I'm not doing anything that is forward moving for my community. So all I'm doing is actually wasting my time and theirs.
Wow.
And I don't subscribe to that. I really won't, and I don't. And that's how I stay committed to my own personal convictions and objectives. I will also say that it's important that you're working to improve representation. If you're doing this work and you don't have the representation of those you purpose to save, then you are not knocking the ball out the park. The ball is sitting there. It's just sitting there, and you're
You
just
gotta go get
swinging.
you some Black people.
Get yourself some Black people, okay? Get yourself some Black people, because that's important to the value of the movement. We feel energy, and not saying like my doctors run the gamut of all cultures. Like that's not just, I don't only have to have a Black doctor. I have Black doctors. I have Caucasian doctors. I have a Lebanese doctor. My doctors run the gamut, and I'm grateful for my team. What I have the most, though, is doctors who care. And they talk, and they connect, and they don't play about me, because they find me when I hide at conventions and conferences. So that's how I know. Never mind. It's not a conversation. But
but it's about a personal connection, right? Like,
yes, but they're also even personally vested in me. They're invested in my community and the work that I do. So they want me well, because they know my wellness is important to the movement of other people's wellness. How about that?
yes.
How about that? That is important. And I would also say lastly is every element of anything that you're doing in health equity, and patient support and patient advancement should have advocacy in it. Advocacy, and empowerment. If anything that you're doing doesn't deliver an element of advocacy and empowerment, then you're not advancing them to do anything.
Yes. So let's talk really quickly. I only have two questions for you, and then we'll open it up for our participants to ask questions too. The first is, you talked about going out and getting you some Black people, right? Like, everybody doesn't have the representation in their staff or in their organization, and they may not even have access to a whole lot of Black people. But let's talk about COGI's ambassador program and what that looks like in, I think, building capacity and finding people who can help you infiltrate some of these communities you want to get connected to.
Yes, yes, we have a great ambassador program. Our ambassador, we're a national/global organization, and we've now been to Poland and Portugal, and so we're kind of just spreading our wings like an eagle fly. Okay, never mind, I'm not gonna sing for you guys. But our advocacy program it embodies our ambassadors as well, and they are located in over 20 states, and they are the voice and the mobilization of the organization. And we bring them to Capitol Hill once a year. We take them in front of their legislators. We train them on storytelling, how to contact their legislators, how to write letters. We get them glammed up, and I've had people say, why are you doing their makeup? I said, because when you look good, you feel good, and it makes you feel like you're valuable. And we want all of our community members to know, whatever their story is, wherever they are on their journey, they are so incredibly valuable to advancing this disease space, the opportunities in this disease space, impacting policy change. And we mean that. You know, I say what I mean. And so our ambassadors, they go to doctors' offices, they sit with patients, they take phone calls, they write thank you notes. We send bears out time that says, bear with me, I'm healing. You know, they do a lot of the work to ensure that other Black and brown patients have the support they need, because most of them are still like with us from the very beginning, and we're 4.5 years old now. So they were able to get the support that they needed from me and us, and they know how meaningful that is and what that's meant to their journey to move forward. And some of them have gone on to get even other deals from what they've gained from us, because I'm always sharing who they are and putting them in pamphlets and putting them in materials to actually brand their opportunities to be bigger and broader, so that other people that have suffered can find them.
Okay. Now here's a question. In your opinion, what are the most urgent priorities in health equity that we should be focusing on right now?
I feel like one of the most urgent is awareness. And I think that's always going to be it, because there's still so many people, especially in inflammatory bowel disease, that don't know what it is. They just don't know. And they often, I was in 2 weeks ago, I was in Bethesda, Maryland, seeing a rheumatologist, and I went to check off diseases. Like, they were asking you, do you have any other health conditions? And I'm checking them off. And what was on there was irritable bowel disease. What is that? What is that? You are a rheumatologist office, who I was referred to by my gastroenterologist, and it said irritable bowel disease. So there's so much information and miseducation that it's even hard for patients to get the right education from providers. Irritable bowel disease is no such thing. IBD is inflammatory bowel disease, which is an autoimmune disease. IBS is irritable bowel syndrome. Completely different. Although some symptoms overlap, they're different things, different managements. And so for this doctor's office, for me to be going there, what do I check? It sounds like it's a combination of these things, because what is it? So for me, it's educating people on what diseases are. That's like one of the most pressing health equity issues. The second, to me, would be the challenges within the healthcare system, just going into the hospital system and going in there, not receiving the care that you need because of bias. And so training our providers not to have the stigmas that they were actually taught and what was ingrained in them in medical school. There needs to be compassion.
So we have to start the training way back. Yeah, at
Yes.
that point, we have to start the training earlier, right? Okay.
Yes, yes.
So, I shared on our first meeting as we close and open, get your questions ready, participants. I shared that one of the most traumatic experience I had was with my primary physician when they gave me some lab work, paperwork, and I looked on the paperwork and it had race and it said multiple. And I got so infuriated by that because no one had bothered to ask me. So someone in the office had made an assumption. They didn't ask me how I identified or what my ethnicity was or anything. And they put down that, and I thought that was potentially harmful to my health, right? Like that there are diseases that disproportionately affect people who are Black. And if you don't have me listed as Black, perhaps I'm not being tested or being, or whatever the case is. So for me, it comes down to there is such a difficulty in discussing race, whether you're in a patient advocacy organization, whether you're in the hospital system, whether you are, an institution, everyone feels uncomfortable discussing it. But until we're willing to at least have the conversation, how to identify also, how has race in your memory, how is race showing up in your regular, daily lived experience? We're missing the mark on truly engaging communities of color. What do you think of that? We'll open it up for some questions from the audience. Uh-oh, you're on mute again.
No,
There you go.
I thought you said I'm going to now open up for some questions. I didn't hear that you.
Oh, no,
cut
I was
when-
asking, what do you just think about like unwillingness to talk about race and all of this ecosystem of healthcare and providing?
I think you can't be unwilling. I mean, as much as people are tired of talking about it because I think it's fatigued, we're tired of living it. So how do you think we feel? You might be tired of hearing about it, and even the discussion is relatively new to my, in my perspective. It's still relatively new that we get to unapologetically discuss it, because that's kind of where we are right now. But we've been living it all of our lives. So just as much as people might be fatigued at the relatively new discussions around this, surrounding the challenges, people have lived it and they're tired of living it. And so I'm sorry. And I'm not.
Absolutely. We're going to go ahead and open the line. I'm going to remove the spotlight and we'll convene our meeting. If any of you have any questions directly from Melodie, we'd love for you to either put them in the chat or just come on camera or just come off of mute and ask your questions of her. Additionally, if you have some things that are working well in your organizations or in your work, we'd love to hear those. Or if you have some challenges you're navigating and connecting with communities, we'd love to talk about and dissect those together too, so that we can get to some best practices. So I'll pause and open the floor up for anyone that might have questions. And if no questions, I'll keep asking, but hopefully you all have, we'll take advantage of this wonderful opportunity because she's in the trenches doing the work very successfully. All right, I'm gonna let you guys get your questions and your input and insights together. But Melodie, I have a question for you, and you have to come back off of mute. How has COGI been received, right? Like sometimes when regular old people, and in your case, regular old patients, right, with not a lot of nonprofit background or experience, decide to do something and then it becomes a big thing, it's not always well received in the ecosystem of institutions and healthcare. So I'm gonna ask you to come off mute and then tell us a little bit about that.
It's different today. I think that today COGI is in extremely high demand. A lot of partners, larger organizations, they are requesting our support and asking us how we do things and can we partner. And it's different now because they see that we've really done the work and been extremely intentional, but beyond intentional, successful. We created a conference that it will blow your mind. It doesn't feel like health. It just feels like a family reunion meets a cookout, meets a party, and it's health. And Chrissy, you were there last year, like for the first time, for the full time, and you got to even host one of the programs. And it's an experience where doctors even become more vulnerable in this space. They like forget that they remove the lens. I don't think they forget. They just remove the lens that they have in the doctor's office, and they become more human because they're enjoying themselves and they feel like they're now in the middle of family. And so their care for these community members at this conference is a very unique kind of compassion and delivery for them. And I love that because we've allowed everybody to remove the veil and to just be people and get the support and help they need. And prior, when we launched, we were met with challenges. People didn't think that we'd be valuable or viable or not here. We'll be here as long as we have been. I mean, and we're not even that old. We're moving to 5 years, but we've been a multi-million-dollar organization for several years now. And that is because the work that we do and the authenticity and the heart. I am not historically a nonprofit leader. That's not where I come from. I come from entrepreneurship, but I also come from grit. And I come from tenacity and endurance. And to manage a disease for over 25 years without diagnosis, I have to be hard as nails because that's literally tough shit. And to go through something and to be diagnosed finally while having 8 fistula, rectovaginal fistula, and going through over 13 medications and inserting them in places that I would never hope that other people have to while managing with drains from my rectum, I was built for tough. So I'm here to stay. And even in those challenges of people trying to minimize our work, all I saw that was threat and envy. And that's not mine to carry. And I didn't. I had other people that I needed to move forward because they were left behind. So it wasn't my work to support other people's challenges and lack of regard for the community. My work was to move the community because, as I said, God told me to build it and they would come. And so when he said they would come, he didn't remove those that would try to disqualify my work either.
Wow, amazing. I must say, I did attend your conference briefly last year, and I attended it in its totality this year. It is quite possibly, and I say this in all seriousness, the Blackest experience I've ever had. Like, whatever that means culturally, right? It was, filled and packed with culture and I think authenticity from every direction. It's real Black. But the thing I loved most about it were the non-Black practitioners, pharmaceutical reps, doctors, patient advocacy organization heads who came and got to experience that genuine invitation into Black culture. And like you said, I think not only does it push back the veil, it breaks down barriers. It breaks down misunderstandings. It starts to open minds and hearts to, what's important to whole communities of people. So thank you for holding that. And for those on, it's an experience like no other. I know Melodie has some like sizzle videos and different things online that you can look at too. So I will, number one, stop and thank Melodie for sharing your journey, your organization success, and all of the pathways that you have given us to be more successful in our quest for more health equity and more engagement in the Black community. For those of you who want to get connected to Melodie, her website is www.cogi.org. No, COGI. That's not it. It's something.
Nope.
www.colorofgi.org.
www.colorofgi.org.
Yeah.
GI.
Colorofgi.org. And we'll send that out with the recording, with the post materials as well. So we encourage you to get connected to her and her work and to use her as an opportunity to advance your own strategies for inclusivity in Black communities. And we encourage you to stay connected to ABC. So we will continue to convene these Health Equity Alliance meetings. Hopefully you gleaned something from our conversation today and will want to stay connected with us, and you can reach out for more information about that as well. I will stop and say thank you all for being present and caring enough about this work to come and learn and convene and discuss it with us today. So we appreciate all of you, and we will close our meeting at this time. Thank you all so much.